This video will cover the basics of the skull of the axial skeleton in under 8 minutes. A quick review. There's 4 types of tissue in the body: epithelial, connective, muscular, and nervous. Bone is made of connective tissue, which consists of cells, fibers, and ground substance. Bones are organs that also contain epithelial tissue in the lining of the veins, arteries, and capillaries because they're well vascularized. Bones also contain nervous tissue and nerves. The axial skeleton. There are 80 bones in the axillary skeleton that consists of the skull, vertebral column, and bony thorax. The skull is comprised of the cranium and the facial bones. Cranial bones encase the brain and provide attachment for head and neck muscles. There are 3 fossa sections, and remember, fossa is a depression or a hollow. Number 1, the anterior cranial fossa corresponds to the frontal lobe of the cerebrum in the brain. Number 2, the middle cranial fossa corresponds to the temporal lobe in the cerebrum. And number 3, the posterior cranial fossa corresponds to the cerebellum. There are only 8 cranial bones. The paired bones are the temporal bones and the parietal bones. And the unpaired bones are the frontal bone, occipital bone, sphenoid bone, and ethmoid bone. Remember that the flat bones in the skull are membrane bones that are formed from mesenchyme through intramembranous ossification. The parietal bones are the bones on the top of the head. They're superior and lateral, so they're on the sides of the skull and bordered by all 4 sutures. The sagittal suture is superior on the top and it joins both parietal bones together. The coronal suture attaches the parietals to the frontal bone. Squamous suture attaches the parietals to the temporal bones. And the lambdoid suture attaches the parietals to the occipital bone. Frontal bone. The squamous part of the frontal bone is the forehead. It's flat. The supraorbital margin forms the superior or upper part of the eye socket. There's a supraorbital foramen in the supraorbital margin, which is the eyebrow ridge. The occipital bone is at the posterior of the cranium. The foramen magnum is the hole for the spinal column that is made of bone and the spinal cord that's made of nervous tissue. The other big landmark is the condyles that articulate with the first vertebra, the atlas, that holds the head. The temporal bones are inferior to the parietal bones, and they encompass the area around the ears. The primary landmarks include the zygomatic process. Inferior to the zygomatic process is the mandibular fossa that articulates with the mandibular condyle on the lower jaw. The external auditory meatus is the ear hole, and just posterior and inferior to that is the mastoid process. The sphenoid bone is a bat-shaped bone with a set of greater wings and a set of lesser wings. The sphenoid spans the width of the cranial floor. The sella turcica is the saddle, and it's the seat of the pituitary gland inside of the skull. There are 2 optical canals. The ethmoid bone lies between the nasal and sphenoid bone. It contains the superior and medial nasal concha. The crista galli is on the inside. Moving on to the facial bones. They're the framework of the face, with cavities for the sense organs of sight, smell, and taste, and openings for air passage and food. The facial bones have 2 unpaired bones, which are the mandible and the vomer, and 6 paired bones. The mandible is the lower jawbone that has a U-shaped horizontal body with 2 upright rami. The mental foramen is the hole near the chin on both sides. The mandibular condyle is at the top of the ramus, and it articulates with the temporal bone. And then moving down from the condyle, it slopes into a mandibular notch that raises up into the coronoid process. The maxillary bones are paired bones that articulate with all other bones except for the mandible. The maxilla extends all the way up to meet the frontal bone at the frontal process. The small holes underneath the eye orbits are the infraorbital foramina. The zygomatic bones form the anterior or front part of the zygomatic arch and the lateral or far sides of the eye orbits. The nasal bones form the bridge of the nose. The lacrimal bones are small bones in the eye orbit near the tear ducts in the medial orbital walls. The palatine bones are on the roof of the mouth, further back than the maxilla, and it completes the hard palate. The vomer is the inferior lower part of the nasal septum. The inferior nasal concha. These bones are in the nasal cavity and are below the superior and middle nasal concha that are part of the ethmoid bone. Some bones have air-filled sinuses that make the bones lighter and communicate with the nasal cavity. These 4 bones include the frontal, ethmoid, sphenoid, and maxilla. Okay, and that's it for the video. So it's just the basics. If you're interested in looking at the notes, the script is in the drop-down box.